Welcome to the Aesthetic Angle, presented by Monarch Plastic Surgery, Kansas City's #1 resource for all things cosmetic, wellness, skincare, injectables, and of course, plastic surgery. Today's topic is weight loss, especially after using GLP-1s. I'm joined today by our nurse practitioner, Laura, and our nurse injector, Kirsten. So we're going to talk about weight loss management medically. We're going to talk about how we help patients with fillers and injectables during their journey, as well as after they've maintained their weight. And of course, surgical options help them look their best after they've lost their weight. So let's start with Laura. Hi, Laura.
Hi.
Before we jump into the surgical aspect of things, can you kind of briefly tell us how we do things at Monarch as far as starting with the consult process and how you help people along their journey?
Yeah, I'd love to. So when clients come to me looking for medical weight loss options, of course, we do have GLP-1 medications that we use that are very effective. I like to start by talking with the patients about their goals. And typically we dive into nutrition. We want to ensure kind of what their diet modifications have been. Are they following any type of specific diet at this point? Obviously, we talk about exercise. It's very important to get baseline metrics. We'll look at their lean muscle mass, their skeletal mass, visceral fat, as well as body fat. Putting that all together, we want to make a plan of dosing, which medication's appropriate from them. And again, focusing on healthy weight loss, not wanting them to lose weight too quickly, establishing, I would say, just realistic expectations. Education is very important so they understand how the GLP-1 medications work, as well as looking at protein goals and diet, because all of the studies were done with weight loss based on nutrition and exercise in combination with the medication. So we start there. We follow closely visits each month to get their weight, look at their body fat percentage, again, adjust medication dosing, and talk about diet and exercise.
I love that. So I like how you said it's healthy weight loss. So other than medications, you're starting with the baseline labs, you're looking at the nutrition. Do you recommend a specific diet or just tailor what they're already doing?
That's a great question. Typically, we'll look at protein goals, so 1.2 to 1.5 grams per kilogram. So we do establish that for the patients, and that gives them a good guide. We do talk about and give them a list of protein-rich foods and the serving size. So we'll come up with ideas that they would like. I do recommend different protein shakes, which is a really easy way when you don't have a great appetite to ensure you're getting protein. Yeah. So that can be 25 to 30 grams just from the shake alone. We talk about high fiber foods, so you still want to focus on whole foods. That combination's a really good baseline, and they can switch out foods that they like. So that's where we start with the nutrition.
Does anybody come in with their protein goals already met? Or do you have to
I was just going to ask that. Like, do people come in with their diet and exercise plans already in place? Or
yeah, so a lot of clients have, maybe they're exercising 2 or 3 times a week. I typically recommend strength training. So we're going to avoid the muscle mass loss, continue to keep lean muscle mass is really important when you are losing weight. We want to lose body fat versus muscle. So we do focus on the strength training aspect when it comes to the exercise. And yeah, diet, a lot of people are not getting the protein that they should anyway. When we talk about 100 grams of protein a day or maybe 120, they think that's a lot. But when we break it down to 25 to 30, 3 to 4 times a day and spreading that out, it's actually doable and you'll work up to that. So I always tell clients, let's work up to that. Maybe you're getting 60, 65 grams. Instead of some of those higher carbohydrate foods, we're going to switch it out for something. And I always tell the patients to consume the protein first on the plate. That way they ensure they're getting it instead of that.
Full.
Yeah, exactly. Because you're not going to have as much of an appetite. So yeah. So we work through that.
Okay. And with exercise, is it obviously resistance, but do you have a plan for them? Do they see a trainer? Is it their option?
Yeah, that's a great question too. Some are working out at gyms, so they go to classes, doing Pilates. So they're already doing something that's active. We may just adjust it a little bit, add in 2 days of like free weights. We do kind of talk through that, but I like that clients can figure out what works for them. And with exercise, you want to be motivated.
Right.
You want to do something that you're going to stick to. And so that's really up to them to figure out what's right for me. Where do I want to join a class, join a new gym, get a trainer is always a great option. So it's more tailored to them. Yeah, and depending on kind of their limitations or health in general, we may kind of adjust things as needed, more like yoga, more Pilates, if there's joint issues. So we focus on that. Yeah.
Prior to GLP-1s, we would see the massive weight loss patients after surgery. They've lost 100, 150 pounds. But I assume we're seeing everything across the board now I'm seeing more like, I lost 30 pounds, I lost 60 pounds. So in your experience, where are your patients usually? Do they need to lose 30, 50, 100? I'm sure it's all, but what do you see most commonly?
Yeah, the studies with GLP-1 medications, which is semaglutide or tirzepatide, were done over a year. And so 20% on average weight loss. So again, that's going to mean, depending on where you start, you can hopefully get to that 20% with the diet and exercise. Again, that's really important to stress. It's not just medication. You're really wanting to make some changes. And even coming off the medication, I get that question a lot. Can I come off of a GLP-1 or take a lower dose and still maintain the weight loss? That's highly dependent to, have you changed some of your habits? Can we spread out the medication where you're not taking such a high dose? It's really all over the board. GLP-1s are very powerful medications. They work really well. So again, kind of getting patients to that goal. If it's 40 pounds, where they want to feel better, improve their health outcomes, we may have to, again, make some diet changes, increase protein as we're going, and play around with the dose. So it's really all over the board.
Okay.
Yeah.
Well, it can be very rewarding because not only are people looking better, they're feeling better, but they're also making them healthier. You see patients, I'm no longer diabetic.
Yes.
I'm no longer on insulin. And they're going to have a longer life. They're really changing their entire life from every aspect, from inside to outside. So it's got to be very rewarding.
Yeah.
It is, yeah. And I think especially, as you said, they feel better, more confident, more energy, they're sleeping better. So they have all these subjective, improvements, but objectively their lipid panel improves, inflammation goes down, metabolically, their A1C, which is your average glucose over 3 months, is better. Everything improves. Their immune function is secondary to that. When you drop inflammation, better metabolic flexibility. They have less joint pain. I've had patients who have postponed a hip replacement or a knee replacement, which is great too, just by losing 20 or 30 pounds. So yeah, all around it's if it's done the right way, it can improve your health in so many different outcomes.
Well, think about also just the way everything in your life improves. It's not just your health, but even like your relationships and like, I don't know, just when you feel better, everything outwardly is better.
Absolutely.
You're truly changing the wellness of the entire person.
Yes.
It's amazing.
Just a positive outlook about everything.
Yes, absolutely. Yeah.
When you talk about inflammation, that's really diet primarily, right? You're cutting out the sugar and the ultra-processed foods. That really is what's decreasing the inflammation you're speaking of, correct?
Yeah, and when we have more visceral fat, we have more, higher body fat percentage. Typically, you're going to have higher systemic inflammation. And so when we're improving that glucose control, we're losing that body fat. Yeah, you're overall decreasing inflammation in the joints and the organs, the tissues. So yeah.
That's great.
Yeah.
So, Kirsten, you're obviously seeing some weight loss patients and some that aren't.
Yes.
So, can you elaborate for us how you treat someone differently, whether they're in the process, in the journey of weight loss, or if they reach their goal?
Yes.
You talk about how you consult with those patients?
Yeah, I definitely see a wide variety of patients. I think my ideal situation is seeing a patient that is just starting up on their weight loss journey, and we can kind of get on top of any weight loss that they are seeing that they would be seeing in their face, because I think it's really patient dependent. But people do see some sort of weight loss in their face, whether that's, fat loss or skin laxity or skin quality, just decreasing. Not all patients are going to have that, but it's good to get on top of that. So one of the things that I like to do is start those patients on a plan for Sculptra, which is a collagen stimulator. So if we can start stimulating that collagen at that beginning of their weight loss journey, it's just gonna bode better for them in the future, because we're gonna be stimulating collagen as they're losing weight. I like to call it investing in their collagen bank, so we can start that collagen ball rolling. We can target areas that we typically would see volume loss. And Sculptra is a great treatment because you do treat the whole entire face. So you're stimulating collagen growth. Sculptra is a longer duration to see your results. So I would say, up to 6 months after their final treatment, we're still seeing collagen production. So that's why it's good to get on the ball of, let's start this as you're starting your weight loss, and we'll just see the benefits as you're seeing the benefits from the weight loss.
So Sculptra is different from a typical HA filler.
Definitely.
So can you describe for us kind of how you use Sculptra? Like, you have to mix it and do some things, and you see some swelling initially, and then it kind of goes away. Can you kind of dive into that for us?
You said it all. So I would say, Sculptra comes as a powder. We mix it with sterile water. We inject it throughout the face. You can hit lots of different areas, like I said, temples, cheeks, jawline, kind of the front part of those cheeks, the smile lines down in the chin shadows. So you can hit all these different areas with Sculptra. Initially, you are going to see that Sculptra kind of filling in areas, but a lot of what you're seeing is the fluid, that sterile water, with the Sculptra suspended into it. Your body will then absorb all that water. So a couple days later, it feels like nothing happened. But then over time, your body will be stimulating collagen growth. And that's when you start to see the real benefits of the improved skin texture and quality, volume, loss gets better, or you're just building collagen in those areas where you're seeing volume loss.
And that's typically a series of treatments?
Series of treatments, at least 2, sometimes 3, depending on the level of volume loss that we're trying to correct.
And then what's the maintenance after that?
Typically just 1 maintenance treatment per year. A standard treatment is going to be multiple vials, usually 1 per side of the face of Sculptra. And then a maintenance treatment annually is going to be just 1 vial annually to maintain those results.
Okay. Well, for me, my favorite filler is fat.
Yeah.
So,
yeah.
in spite of all their weight loss, if I'm doing a facial procedure, rejuvenation procedure after weight loss or just from aging, I typically use fat because it's the best. It has the stem cells. It's your tissue,
Yeah.
But you do have to have a donor site. You have to harvest the fat from somewhere. You've got to do liposuction. You've got to collect it sterilely, wash it, then re-inject it. And so if I'm doing a facelift procedure, it does tend to make patients a little more swollen, and you do overfill because you're only going to get 50 to 70% take. So it does prolong the downtime a little bit, but it's still my favorite filler. But of course, there's good things and bad things about everything we do, right? There's always options.
How long would you say it takes to get to your final result after doing a fat transfer?
I would say 6 weeks. It's done. You're going to keep the rest of that.
Yeah.
I would say 6 weeks on average.
And are you typically doing those in combination with a facelift?
Yes.
Okay.
Yeah, it'd be very rare to do that in isolation.
Yeah.
So, but for me, I see patients sometimes during their journey and sometimes they're already stable. So I want them to be at a stable weight for 6 months before we do anything. And then it really just depends on where they want to start. Of course, most commonly we're doing tummy tucks. There are different types of tummy tucks available to people depending on their needs. There are mini tummy tucks where we don't tighten the muscle. We just work on the lower half of the abdomen. There are full tummy tucks where we are doing liposuction with skin removal and muscle tightening. There are fleur-de-lis tummy tucks where if someone's lost, 100, 150 pounds, we not only do the typical bikini line incision, we add a vertical component to bring in the tissues in both the horizontal and vertical planes. If someone's really lost a ton of weight, say 150, 200 pounds, then I will usually come back and do a reverse tummy tuck after that, which means I'm pulling from the bottom up because you can't, some people have multiple folds on their abdomen if they've really been heavy. And so the tummy tuck would treat the lower half, but there's still this upper laxity. You can't just lift the entire abdominal skin off the abdominal wall. It needs a blood supply. So we come back and pull from the top to get that upper tightness we didn't quite get from the first time. So it's a process, but we can still end up with a flat tummy usually.
Yeah. Do you feel like you see more weight loss patients coming into you with concerns about body, or would you say it's face?
More about body.
Body. Yeah.
Our most common procedures would be a tummy tuck of some sort and arm lifts, and then thirdly would be thigh lifts.
Okay.
Of course, face lifts, too. So.
Yeah.
Yeah. So I've had a handful of patients either before or after that are looking for liposuction or, and they need to lose weight, as you mentioned, and be stable, so that procedure, whatever they're aiming for and their goals are going to be better outcomes for them.
Right.
So I've had, and I also had a client who'd had liposuction on her abdomen and thighs, had been on a GLP-1, unfortunately went off and started gaining weight. And so she came back to see me. We put her back on a low-dose GLP-1, really worked on nutrition to get some of that weight she'd started gaining off, as well as just maintain her so that her results were could last and she, felt good and didn't have to go back and do surgery again, of course, and repair anything. So there's, lots of different patients, lots of different, treatments they've had and how we can all work together, again, with the Sculptra or filler and all the cosmetic procedures they can do. So it's really a one-stop shop here. You can, see
absolutely.
any of the providers that you need are here. So,
Yeah. And for me, it really depends on their age and the amount of weight loss. If someone's young in their 20s or 30s losing weight, they're not going to need a facelift. This will be more the body. Right. Again, typically tummy, then arms, then thighs. But if someone's older, when we age, we all could use some facial tune-ups anyway. But you add the weight loss to it, they can be more dramatic. So then we're doing upper eyelids, lower eyelids, face and neck is a big one with weight loss. Skin lax in the neck, extra fat deposits that just are resistant to the weight loss. And at Monarch, we offer the deep plane facelift and the option of local anesthesia if they want that, or we can go to the surgery centers, their preference. We also offer the deep neck lift, so we can really contour the necks and faces, those jaw lines, get that angle back, and give them a natural facelift, but something that's significant. So it really depends on what they want and the order they want to do it in, and whether it's local or general anesthesia.
Mm-hmm. Laura, I do have a question for you. I see, I don't see as many patients coming from you that have a lot of volume loss in their face, but I see it so often. They've come from a different company or different office, and they've had a lot of volume loss in their face. Is there anything in particular that you do with your weight loss patients to prevent something like that from happening? And do patients come to you with those concerns?
That's a great question. I've had patients that are just starting out, so we really, again, want to focus on the nutrition aspect with the protein, with the exercise, and weight loss, doing it steady and not quick. And of course, patients want a fast result, so they get worried sometimes. I only lost 5 pounds this month. Well, that's still a lot of weight. It's 1 pound a week, a little bit more. And so we will sometimes just titrate the medication more slowly. And as you're asking, I do have patients that have come from other weight loss clinics. Maybe it was an online source where they were getting it. They've told me they didn't have a lot of direction with nutrition, with, a steady, just the monitoring and adjustments of the medications so that they had steady weight loss. So that probably would be the one thing would be different that we're able to do is provide a tighter management and control for these patients. And, I was also going to say, I typically don't see as much volume loss with the younger clients because I have patients of all age. They have better quality collagen to begin with and elastin. And so they're losing weight, and you typically don't lose weight and just it's not a spot treatment. And I've had clients say, well, can I just lose weight off my abdomen or my thighs? So unfortunately, it doesn't work like that.
I know, you never lose it where you want to lose
exactly, right. You're going to
never
lose
keep it where you want to keep
They're
it.
like, I don't want to lose volume. volume in my face.
Yes.
So you can't always tell, especially everyone's body composition is different.
Yeah.
And so, yeah, but the older patients, the clients are where you typically do see more volume loss in the face, especially if they have a lot of weight to lose. And so that's when it's appropriate and perfect to send them to one of our injectors to get a consult and see if there's anything that could help prevent that or replace some of that volume.
Right.
Okay, well, I hope if you're considering a weight loss journey or you've already started and you need some help, you can tell that Laura is very passionate about this. And that just gives her so much satisfaction in life, helping people achieve their goals. Kirsten obviously is excellent at facial rejuvenation, giving appropriate contours. It looks very natural. It's not overdone. And so we're just here for you at Monarch. We want to help you with this weight loss journey. We're here for the nutrition, the medication, the counseling, the injectors, and if needed, surgery. And I love having people look better and feel better about themselves. It's been my passion for the past 23 years. So if you're considering this, contact us at Monarch. Thank you.